Welcome back to our YouTube page. We are here with the amazing Dr. Ari KRAU. We are talking rhinoplasties once more. So our next question will be, what are some things that we can expect post-op after our nose procedure?
So like any procedure, it takes a while for the results to show themselves and for the post-operative changes to settle down. As a general rule, 48 hours after surgery is the maximum amount of time where swelling shows itself, and then the swelling starts to resolve. In rhinoplasty, for sure, there's a lot of swelling the first week, peaks at 2 days. It's hard to see it because almost all the time there's a splint on the nose that we usually take off a week later. And when we take that splint off, the nose has, you got the impression of what ultimately it's going to look like. You take the splint off, the swelling is going to set back in a little bit, so that second week may not look as good as when you initially took the splint off, but beginning 2 weeks later, as the swelling starts to dissipate, you start to see the form of the new nose. As a general rule, at 1 month, you're about 80% there. But nose changes, particularly in the tip, can take 6 months or sometimes up to a year. So if there's any touch-ups that needs to be done after surgery, because there's always a possibility of revision, that should not be done after at least a year when we could see the final results.
And as far as working, because that's a huge question for a lot of our viewers and future CG dolls, how long should we expect to take off of work from this?
In the case of rhinoplasty, it's not really an uncomfortable operation as far as discomfort, but it is a little bothersome because there's a lot of congestion there. The patient's going to have a splint on their nose for the first week. There may be a little bit of black and blue under the eyes. One can go back to work, to school in that first week, but that's a personal choice. I don't think a lot of patients really want to go back to school with bandages on their face. At 1 week, everything pretty much comes off. There's signs that recent surgery was performed a week after. Most patients do go back to work at 1 week. As far as activity goes, we want to not overexert yourself. The patient does not, we should not overexert herself or himself the first 3 weeks after surgery, because the more the blood flows, the more the swelling will be produced. So we recommend them taking it easy. Patient also have to be a little careful in the first 3 weeks, because when we move the bones of the nose, they are sticky, but they're not fully healed for at least 3 weeks. So a significant amount of pressure on the nose can displace those bones, and that's a problem because that's not that easy to fix right away. Often you have to wait a while until everything heals and then go back for revision.
All right, well, you heard it here first. Dr. KRAU says, please take as much time as you need to after your rhinoplastic surgery. We have more information coming to you very soon here on our YouTube channel.